So recently I've felt some pain inside my lower back and hips, sometimes my shoulder. Is there anything I should do? Please help me.
Hey, what's going on, guys? This is Pete from PeteHusband.com. Welcome back to Ask Pete. This is episode 17, and today's question is...
So recently I've felt some pain inside my lower back and hips, sometimes my shoulder. Is there anything I should do? Please help me.
So based off what you said, I know from personal experience exactly what you're feeling. It's frustrating, maybe you're a little tighter than normal. For me, it was always my hips, my lower back, and it became an issue for me. I don't know if you guys know this, but recently, exactly almost a year ago, I had a full hip replacement. I'll show you guys pictures and videos of that. It's not a great feeling. But what I didn't do was I didn't catch the warning signs early. I really tried to just push myself. I warmed up a little bit, I did some simple rolling, some stretching, and ended up working out more and more and more, and just kept ignoring the fact that I was in pain. The biggest mistake of my life, okay? And as a wrestler, that's what I was trained to do, that's what I was bred to do, because you don't want to take off. You don't want to be told that you can't work out anymore. You don't want to be told sometimes the truth. Maybe it's something else, you know? And for me, I had a condition that no one really spotted out until I finally saw a healthcare practitioner, and I saw a physical therapist, one that I knew was well educated, took great advice from, and just had a good track record of helping people out. You know, and after I saw my physical therapist, they led me in the right direction. They tried their best to fix whatever it was, and after a while it just wasn't working, and so they know that something was up. So what they did was they said, hey, maybe you should go get an MRI, get an x-ray, let's go see what exactly is going on there, because obviously what we're doing isn't helping. And they're always going to give you the best route they can in their best interest, because a good physical therapist, a good personal trainer will always refer out whenever it's out of their scope. And for me as a trainer, I will give you exercises and stretches, but there comes a point when that's not enough and it's completely out of my scope. Usually when I hear pain, I say, hey guys, here's my physical therapist number, give them a call, because you're better off getting it checked out early before it becomes a chronic condition or something that really just fucking hurts, okay? And if you hold it down the line, some days it's gonna feel good, some days it's not gonna feel good. But if it's not feeling good, there has to be something done in order to make it feel good. Go get it checked out. Get the real answer from someone. I'm not saying go to your doctor. Don't go to your doctor immediately, because usually, in my personal opinion, they give me drugs, they're gonna fucking script me up. Perfect, yay, thank you for the anti-inflammatories. You didn't solve my issue. My issue is something going on, right? It's structurally, it's muscular, I don't know what it is. But taking medication for me is not the route that I like to go, which is why I always go to a physical therapist first. All right, from there, they'll work with me. A lot of us think that going to physical therapy means that you need to get this and you have to get a script. Yeah, just go find someone that you like, know, and trust, and they will lead you in the right direction. So my biggest message to you is, in the beginning, hit some stretches. Always stretch. You know, it's one thing that I haven't done in the past, which I do a lot. Like even this morning. Something over here was tight because I was dancing my ass off at a wedding, right? I was fucking ripping the dance floor. So now this is all tight. My glutes are tight, my hips are tight. 2-3 days straight. I've been trying to work out, and then I started to work out this morning. I started to hit farmer's carries, I went to medicine ball slams, and then some pull-aparts, and it just wasn't loosening up. So after 4 sets, I was like, you know what? Let me call it. Let me play it smart. I ended up doing my main stretches, my glute stretch, my hip flexor stretch. If you guys want really good stretches, go to my friend's channel or my therapist channel, Dr. Nick, Feel Good Fridays. He's got some really good stretches for your glutes, hips, shoulders, and I'll put that link down below because he's he'll better explain the exercise than I will. I know them, but a little bit more technical side, some minor tweaks. I'm gonna leave it to that guy because he's the physical therapist that I use, along with other people like Kerry, who's awesome, and Dave as well. So my message to you is, if you're feeling that pain, and that pain's lasting longer than a week, guys, ice and stretching isn't helping it. Ice and stretching isn't helping it, well then it's time to go to the next person in line, all right? Because that's out of my scope, and I want to make sure you guys are taken care of. So go see a therapist. If If you need one and you guys are in this area, let me know and I'll refer it out to you. If you guys are in your area, talk to people, right? Find out who helped the best. Look up some reviews, see who the best therapist is in your area and go check them out. So I'll see you guys later. This is Pete, PeteIceman.com. Thanks for coming out, and always like, subscribe, and comment up, and I'll see you guys soon.